Good day everyone, my name is Tabas Castillo, so now I'm going to demonstrate the endodermal medication. Endodermal injection may be given for diagnosis purposes such as allergy and tuberculosis testing. So now we're going to check the doctor's order. Then, the rationale of this is to ensure to give the right medication to the right patient. So now, check the medication administration record to make sure that the correct medication is being prepared. Then, check the labels on the medication carefully against the MR to make sure that the correct medication is being prepared. So, okay. Then, follow the 3 checks for administration medication. Read the label on the medication. Then, when it is taken from the medication card, before withdrawing the medication and after withdrawing the medication. Then, now we're going to organize the equipment. So, to save time and effort, we have syringe, cotton balls, band-aid, vial, clean gloves, and alcohol. So now, we're going to perform hand hygiene and observe the appropriate infection prevention procedure. So I'm done. I'm doing a hand washing. So now we are going to prepare the medication vial for the drug withdrawal. So prepare the syringe and remember to do not touch only the barrel to avoid the contamination. Then, mix the solution if necessary by rotating the vial between the palm of the hand but not by shaking. Then, remove the protective cap or clean the rubber cap of a previous open vial with the antiseptic wipe by rubbing the in a circular motion to not contaminated. So since it's open, have to close. So now we're going to withdraw the medication, then attach a filter needle as agency practices delicates to draw up the premixed liquid medication from maltose vials. Then ensure that the needle is firmly attached to the syringe to avoid injury. Then, remove the cap from the needle. Then, draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. Then, carefully insert the needle into the upright vial through the center of the rubber cap, maintaining the sterility of the needle. Then, in the eye level, inject the air into the vial, keeping the level of the needle above the surface of the medication. So now withdraw the prescribed amount of medication using either of the following methods. So hold the vial down Move the needle tip so that it is below the fluid level or below the medication. And inverts the vial. Ensure that the needle tip is below the fluid level and gradually withdraw the medication. So now we're going to the Endodermal Administration. So explain to the client that the medication will produce a small wheal, so sometimes called a bleb. Then a wheal is a small raised area like a blister. The client will feel a slightly prick as the needle enters the skin. So, hi ma'am, ako din si Febos and Castillo, imong students nurse kong adlaw. So, naaday ko dire kay para mag-administer og skin test. So, okay lang ba si mga ma'am? So, kani siya mama, wala ga skin test to ma'am, naabay mo bulot sa mga ma'am. So, normal lang siya kay, di mo gano'n ito mabalaan kung allergic ba ka. Sige ma'am. Then, provides for clients privacy so that to provide comfort and to enhance the cooperation. Close na ako door ma'am ha. Okay, then, select and cleanse the site. Select aside the forearm about the hands with the above the wrist and 3 of the 4 finger within below the. Then, ma'am, panagsin mo ka po, ma'am. Avoid using a site that are tender, inflamed or swollen in those that lesion. So, if since my clients don't have a lesion, so it's okay to inject here. Then, if you see a lesion, you can choose another side to inject the medication. So now we're going to apply gloves to as indicated by agency policy. Cleanse the skin and the site of using the firm circular motion. So now we're done applying a glove. So we have to clean the selecting site. Then grabs the syringe in your dominant hand close to the hub. Then holding it between the thumb and forefinger, hold the needles almost parallel to the skin surface with the bowel of the needle up to 5 to 15 degrees. Then, now we're going to inject the fluid. So, with the non-dominant hand, pull the skin at the site until it's taut. For example, if using the ventral forearm, grabs the client's dorsal forearm and gently pull it to lighten the ventral skin. So, insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. So, now we're going to stabilize the syringe and needle and inject the medication carefully and slowly to that it produces a smaller wheal of the skin. Then, withdraw the needle quickly, all the same angle at which is the inserted. Activate the needle safety device. Applies a bandage if indicated. So, ma'am, magsugod na ko, ma'am, ha? Ayan. Magburot na. And then, do not massage the area. So, ma'am, palihog lang ko, mama. Ayaw lang i-massage sa ma'am, ha? Okay. Then, removes the discard gloves. So now we're done. I perform hand hygiene. So I'm done hand washing. So I'm applying alcohol to deter the spread of microorganism. Then circles the injection site with the observed for readiness or induration hardening per agency policy. So tell the patient not to remove the ink. So, ma'am, ako sang kanan, ma'am, ha, para mabala na tukuhan. Okay. So, ma'am, kanang palihog lang ko, ma'am, ha, ayaw lang siya irisa, ma'am, ha, ayaw lang siya kumuha na kanang kuha ang ink, para mabala na to, kung di man ko na to mabalaan kung unsay reaction niya, okay, ma'am. Then, document the revealed relevant information recording the testing material given the time and dosage enrolled. Then evaluates the condition of the 30 minutes depending on the test measure the area of the readiness and induration in millimeters at the largest diameter and document findings. So, ma'am, tanawon ako imong kan, ma'am, ha? Okay. And then, document if the clients had a positive or negative skin test result, follow the agency protocol on labeling of allergy to the patient. So, the patient have no allergy. Also, ma'am, mauna dahil ito, ma'am. Maraming salamat kasi mong cooperation, ma'am, ha. So, karon ma'am, nakita man natin na wala man kay allergic sa penicillin. So, wala na ba kailangan pangutana, ma'am? Sige, ma'am. Salamat. And that's all. Thank you.